All right. Well, good morning, ladies and gentlemen, and welcome to another episode of Daybreak Live. My name's Krissi. I'm with Positively Osceola, and Positively Osceola just wants to bring you news that informs, impacts, and inspires. So thank you so much for watching. If you're watching live, pop in the comments, say hey, say good morning, what's going on? I love seeing who's watching, especially from our community. So just say hi. I have the opportunity of chatting with Dr. Simi George today. She is a hematologist and oncologist with Orlando Health, and she's going to share some really exciting stuff about what's going on in cancer treatment, oncology in general. And I have a big question for her that I will be asking her later that I think you're going to want to know the answer to. So I'm excited to introduce her to you. So without further ado, let's make it official, and then I'll introduce you to Dr. Simi George. Okay, here we go. All right, we are officially into this episode of Daybreak Live. Once again, my name is Krissi, and today I have the honor of chatting with Dr. Simi George. She's a hematologist and oncologist with Orlando Health, and she's a board-certified medical oncologist with Orlando Health Cancer Institute. She helps diagnose and treat all types of cancers, but she has a very special expertise in gastrointestinal cancers. So I'm so excited to introduce you to her. Let's add her to the stream. Good morning, Dr. Simi. How are you doing today?
I'm doing great. Thanks so much for having me, Krissi.
Yeah, of course. This is so exciting. I love getting to chat with medical physicians, and there's so much to learn, and there's still so much that's changing out there. So this is going to be exciting. So tell us about where you work and what you do.
So as you said, I'm a medical oncologist and hematologist with Orlando Health. I was hired as the dedicated oncology physician for Osceola County. So Orlando Health has a long track record of providing cutting-edge cancer treatment in Orange County, and they're looking to expand that to Osceola County. So there's a relatively new Orlando Health facility in Kissimmee on Osceola Parkway, where we are now seeing cancer patients, giving chemotherapies, and expanding services. And we're also in the process of finishing up construction on a regional cancer center in St. Cloud, where we'll be able to do the same thing, have infusion, chemotherapy, et cetera, with new services on the way. So I'm very excited to be part of this.
Oh, absolutely. And I think the community is just thankful because cancer comes out of nowhere, right? It's pretty much weaved into every single person's life in some way, shape, or form. Like, I feel like we all know someone who has cancer or who has battled cancer. And knowing that these options are out there for community members is probably a huge relief for patients, knowing that they have so many opportunities.
Yeah, absolutely. I think historically, Osceola has been underserved compared to Orange County. And now with the significant growth in population, we need more doctors here. So it's exciting to be able to offer all the services of a big cancer institution like Orlando Health and be able to get all that treatment locally.
Right. And what a huge name also, Orlando Health, and they're giving more options to people all over, and being able to have treatments that are more closer to home, I think is very important to people. Okay, so what's your background? Like, how did you get into oncology? Because obviously this takes a lot of schooling, right? You've been to a million different schools. It seems like I was reading your bio. Tell everyone your background.
So I'm originally from New York, like I think most people in Central Florida probably. So I grew up in Long Island. I did all my schooling there. Eventually got tired of the cold and came down here to Florida. I love being an oncologist because it's really not a boring job. Every day there's something interesting. Every patient is different. I learn a lot through my patients, see a lot of inspiring, amazing stories. So yeah, it's an exciting field. There's lots of growth, a lot of newer treatments. We're curing a lot more people nowadays, and when we can't, we're having a lot of people living with cancer, leading normal lives on treatment. So it's very exciting.
Oh my gosh. I'm sure technology is constantly changing too and giving you new opportunities to develop different things. And isn't everyone's job or like goal in their mind is to cure cancer, you know? And I feel like medical professionals like you work constantly. You're on the go all the time, but yet still you're researching and you're developing new ways to help the community. And I think that that is like such a good feeling to know, like underneath it all, you're working your butt off and you're trying to make a difference. And that's why Positively Osceola wants to shout you out, because you're doing such an amazing job and we appreciate all that you're doing for people, because cancer is everywhere, everywhere. So thank you for being a part of it and for changing people's lives. What are some of the new treatments that y'all have that you're going into?
So lots of new and exciting things in oncology. Some of the newest stuff is targeted therapies. So oncology treatment is very different now compared to 10 years ago. We actually test the genetics of cancer cells to look for mutations or abnormalities that we can target. So if you take, two people with lung cancer, one person's lung cancer will be different. It will have changes that we can actually treat with a pill, sometimes with very limited side effects. So that's something that's very exciting. We also use a lot of immune therapy nowadays. We've always known that the immune therapy is involved in controlling cancers, just like controlling infections with bacteria or viruses. But we know that in people who have cancer, the immune system is usually not able to do what it normally does. And we have drugs that actually sort of activate the immune system or take the brakes off the immune system, these immune checkpoint inhibitors, lots with unpronounceable names. So that is all very exciting. So, we see lots of people now living with cancer, as a sort of a chronic illness rather than what it was associated with, years ago.
Right, right. Oh my gosh. Okay, so things are changing and things are consistently getting better, and maybe being able to treat it as a chronic illness instead of something that is going to just take your life away, within a couple weeks. I mean, that's got to be a huge change.
Yeah, absolutely. But the most important things, though, that I want people to know is prevention and early detection. So, in terms of prevention, there are vaccinations that have been shown to decrease the chance of cancer.
Wait, what?
So I guess this is sort of a public service announcement. So hepatitis B vaccine prevents certain types of liver cancer called hepatocellular carcinoma. The HPV vaccine is lowering the incidence of cervical cancers, certain cancers of the throat. So yeah, there's lots that you can do sort of preventatively. The other thing is, all the basic stuff, like we know that obesity is associated with cancers. We don't, really understand why. So a healthy diet, less processed, refined food, sugars, a healthy weight, exercise is protective. Those are all important.
Yeah, that's what I was going to ask you, because everyone says, like, if you cut out sugars, maybe you have less of a chance of getting cancer, or the more sugar you have, the more chance you have of getting cancer. Is that true?
So that is a very complicated question. And as a cancer doc, it's one of the things that I get asked about all the time.
I bet.
Everyone has, seen something about sugar and cancer. So it's complicated because you have to look at the metabolism of a normal cell versus a cancer cell. Okay. So, our normal cells are kind of, boring. They're going about their day-to-day activities. They're, getting their coffee, they're going to work, they're dropping their kids off at school. Whereas a cancer cell has an entirely different goal. A cancer cell wants to divide and grow and make more of itself over and over and over. So a cancer cell is looking to get any nutrients it can get. So sugar is easy for any cell to use.
Right.
But if a cancer cell doesn't have access to sugar, it will take up protein from your muscles. It will take up fat. It will take up, nearby dead cells. It will literally do anything. Whereas, if we don't have sugar around, or we're, sort of in starvation mode, your immune system will kind of, relax and say, this is not the time for me to grow and be active. So in that situation, theoretically, it makes sense, right? Cancers take up sugar. That's how we do PET scans. It's basically a CAT scan. A PET scan is an imaging modality. It's a CAT scan, but you get a sort of a labeled sugar solution that, and the cancerous parts of your body sort of take up this solution, and then it lights up on the screen.
No way.
So it all makes sense, but unfortunately, it's not that simple, because your normal cells need sugar too, especially if you're going through any kind of cancer treatment. Your body needs to heal, whether it's surgery, radiation, chemotherapy. You are not going to get better unless you're, taking in all types of nutrients. And unfortunately, there's no way to target that, away from the cancer cells and towards your healthy cells. So there's a lot of research being done on this, into, nutrition and sugars and cancer. But again, the main thing is, not all sugars are the same. So, eating an apple is different from the sugar in a soda.
Yeah. So, okay. So all cells need sugar. They need nutrients, but your body can't heal when it's fighting off the cancer cells if all
Right.
you're getting is poor nutrition.
Yeah. So, if you have cancer and you're on cancer treatment, we typically don't recommend any drastic dietary changes where, you cut out all sugar, because again, you need to heal from the treatment, and it's just not a sustainable plan.
Yep. No, I totally understand that. I get that. And so if we can limit the amount of sugar that we have, maybe it will help us prevent it. Is that right?
Well, we know that, obesity is associated with cancer. So sugar can't cause a cancer, meaning, if you eat a lot of sugar, your cells aren't going to turn into a cancer. You need some kind of mutation or abnormality to do that. But once that's there, if there's a lot of sugar lying around, can it hasten its growth?
Yeah.
Sure. So yeah, limiting processed sugars is recommended, and being at a healthy weight.
Absolutely. Okay, cool. We have a comment coming in. This is from Diane Cuevas. She says, Dr. George is an amazing hematologist. We're very lucky to have her practicing with the Orlando Health Cancer Institute here in Kissimmee.
Thanks, Diane.
That was so nice. And I'm sure you're doing an amazing job. And that's why we wanted to chat with you. We know you're making a huge difference in our community. So thank you for all of your work and everything that you've been doing. I would love for you to just share with people what should they know about cancer, or what's the most important, what's a pro tip for you that you have for people here that are trying to avoid it?
I think the most important thing is go see your primary care doctor. They know best what you should be doing, what screenings you should be getting. If something feels off, go see your doctor.
Right. There's always going to be another answer, and there can always be testing to be done. So if there's something that feels off, check it out, right?
Yeah.
So
absolutely.
if people want more information, or they want to check out what you do or where y'all work, where can they go?
Through the Orlando Health website. So
Okay.
orlandohealth.com.
Okay. And also there's a number at the bottom of the screen, y'all, for the Orlando Health Cancer Institute, or you can always go to orlandohealth.com. So if you have questions, shout them out. You can comment here and we'll make sure someone gets back to you. But we want to make sure that you have all the information that you need, and Orlando Health is giving you the resources. So make sure you check this out down here, give them a call, or go to orlandohealth.com so you can see what Dr. Simi George is doing to change the world, making one healthy person at a time, right?
That's right. Thanks again, Krissi, for having
You're
me.
welcome. You're welcome. It was such a pleasure. And I hope we get to do many more of these, because there's always going to be cancer, and hopefully there won't always be cancer, but hopefully we can get a rein on it and learn about new technologies and how to change it, right?
Absolutely.
Awesome. Well, thank you so much for your time and your information. Can't wait to chat with you again soon. Everybody, give her a shout. She's an amazing physician, and we appreciate everything that she's doing. So once again, thank you for joining us, and y'all enjoy the rest of your day. It's Wednesday, so happy hump day, everybody. All right, Dr. Simi George, thank you so much, and have a great rest of your day.
You too. Bye.
Bye, everybody.